Let's delve into an intricate but crucial aspect of leading in healthcare: strategy. Often, strategy is seen as a complicated roadmap, but it doesn't have to be. Strategy is really about how you create value. In essence, it's about how an organization creates the most value with the most efficient use of resources. How do you identify and engage the market conditions that will 10x or 20x your deployed resources? So, what do we mean by value in healthcare? We know the concept of value based healthcare, which is really how do we maximize patient outcomes versus the investment required to achieve those outcomes. From the strategic perspective, value is a difference between the organizational performance or achieving desired organizational performance, such as finances, community served, patient satisfaction, versus the cost to deliver those outcomes. The most obvious desired outcome in the healthcare environment is obviously going to be real and perceived value from the perspective of the patients. Three primary drivers come to mind when we talk about perceived and real value from the perspective of patients. And the most important one is the quality of the care. This is non-negotiable. So the question we're asking here is, what are your outcomes? How safe is the care that you're offering? What is the patient experience like? How quickly can persons get appointments? Do they feel listened to? Do they feel like their concerns are heard? All of these things relate to quality of care. And then the next thing that we're looking at is the complementary services. If persons feel like they can get more out of your engaging with your core services, then that increases the value that they're deriving from what you're offering. So these are things like integrated care, availability of specialists, support services. So these things that you can add to your services could actually increase how persons see the value that they're getting from your services. And then we're also looking at building trust. If persons are referring their loved ones, their family, their friends to your services, that builds trust, and that also increases the value that they're deriving. So every patient matters. Right? Every person that comes to the facility needs to be treated with respect as if they are the most important persons that comes to your organization. All of those things put together increase the real and perceived value. So from a strategic point of view, your question should be, how do we design our services such that this very important desired outcome is achieved? Now we can turn our attention to cost. There are a number of factors that drive cost, but I really want to focus on the cost of talent for this discussion. Talent actually is the highest cost in most healthcare facilities or healthcare businesses. But the more willing healthcare professionals are to offer their services through your organization to your clients, the more engaged they're going to be, the more creativity, the more focus, and the more attention you can command from them, right? And this in turn reduces the cost of talent because you do not have to face higher costs, or your cost of absenteeism, low engagement, turnover is reduced. And this in turn reduces the cost that is necessary to achieve your desired outcomes. So how do we make our healthcare business attractive to talent? How do we develop such a work environment that persons actually value coming to work? Right. So how do we do that? Obviously, some persons will think immediately, we will all think immediately about increasing salaries, but there's a limit to that. One, you don't have all the money in the world. And two, there's a limit to how much motivation can be derived from salary increases. The more sustainable and probably the more effective thing to do is to build a work environment that persons feel as if they're cared for, they're listened to, that they're able to do their best work and to grow professionally. They can bring their best self to work and offer their talents to your organization. Are you open to ideas? Are you open to their projects? Are you open to their input? So persons feeling like they could come and offer their best self and so reduce the cost of that turnover, the cost of absenteeism, the hidden cost of poor engagement, dissatisfied staff. So let's not forget that the ultimate goal of strategy is to win in the marketplace, to be the one that delivers the most value in the marketplace. So when coming up with strategy, you need to figure out, where is this arena? Where is the playing field? How can we define the parameters of the game in such a way that it allows us to deploy our resources in the best way to achieve the biggest impact in our community, deliver the most value to the patients, and to deliver the most value to the employees.